Hey everyone, Dr. Casey Schnaba here, and welcome back to Movement Every Day. Today I'm going to be talking about hip flexor and hip flexor length, as well as the strength of your hip flexors. Hip flexors are super important in everyday movement, okay, especially walking. Our society, we tend to sit down a lot, and with the hip flexors, this group of muscles become shortened, and when they become shortened, that can cause pain and problems. And I'm going to show you a way to, one, assess the strength of that muscle, two, to see if that muscle is dysfunctional or short, and three, to fix it with a technique we use called post-isometric relaxation. Real quick to show you a little bit of anatomy. The hip flexors are muscle group right here in this region, and it causes flexion of the hip. Flexion of the hip is this movement, okay? Bringing your thigh or your femur up in this way, okay? The Iliopsoas muscle, or group of muscles, consisting of two muscles. The iliacus, which starts right here on the iliac fossa and inserts down on the femur. Also, it consists of the psoas muscle. And the psoas muscle is a longer tubular structure which starts here within these areas, the vertebral bodies. It also inserts on the discs, as well as the transverse processes of the vertebral bones, okay? And then that muscle joins together with the iliacus, goes over the top of this area, and inserts onto the lesser trochanter of your thigh bone or your femur, okay? All right, we're going to show you how to muscle test the iliopsoas, or the hip flexor, right now with Brandon, okay? Brandon, can you take a lay backwards for me? All right. We're first going to do this side, the right side. So what I'm going to have Brandon do is hold his leg up in this position here, and I'm going to externally rotate his leg just a little bit. And then I'll tell him to hold that position. What I'm going to tell him to do is now meet my pressure, and I want him to hold it there. And it's good. He's strong, okay? Now we're going to assess his left side, okay? Same thing. We're going to rotate his leg out. We're going to have him hold it up there for a second. I'm going to contact the opposite side here on his hip, and I'm going to push down. And it's a little bit weaker, okay? I would say that the left side is a little bit weaker for him. And this is consistent with Brandon because Brandon sits a lot during the day, okay? And he actually has tight or shortened hip flexors. Now I'm going to show you the test called Thomas test to assess the length of these muscles. Come on up, come to the end of the table. And we're just going to do one side for sake of time here. So I'm going to have, your patient is going to bring the leg up to a flex position, and he's going to put his hands around his knees, and then what he's going to do is sit at the edge of the table and lay backwards. Perfect. All right, beautiful. So what we're going to do is I'm going to feel his lumbar spine first to make sure it's in a neutral position, which it is. And then what I'm going to do is I'm going to put his foot onto my chest area. Then I'm going to have him relax his arms, okay? So now he's relaxed, okay? And we can see clearly that Brandon has a tight iliopsoas, or hip flexors. He also has a little bit of tightness in his rectus femoris, which is his quad muscle, but we'll talk about that at a later time, okay? Now, so this I would consider a positive test. Now we're going to go right into the technique to fix this, and it's called PIR, or post-isometric relaxation. And the way I'm going to do that is I'm going to put my hand on the top of his knee, and I'm going to put some pressure down, okay? And I'm going to stretch his muscle to the resistance barrier. I'm going to have Brandon then push up onto my hand about 10 to 20%, and I'm going to have him hold that for about 10 seconds. After about 10 seconds, I'm going to have him take a deep breath in, all the way out, and then I'm going to stretch that muscle to a new barrier where I feel resistance. And you would do that 3 times in total. I'm only going to do it twice for time's sake again, okay? So Brandon, can I have you push up? A little bit more. Good. Hold that. Keep holding it. Keep pushing up. Keep pushing up. Give you a little bit more. Good. In about 4 seconds, I want you to take a deep breath in, all the way in, and then out, and relax. Good. And you go to the new barrier. Now, right away, push back up. Right away, you want him to go right back into pushing back up. Okay, 10 to 20%. He's doing good. All right, take a deep breath in, all the way out, and you push that muscle to the new barrier. Okay. All right, you can relax. All right. You can sit right over there. Perfect. So that's a way to assess muscle length, muscle strength, and then a way to fix and correct with PIR. Until the next video, guys, I hope you enjoyed this. And remember, movement is everything, and movement is life.